Botox versus skincare. What is the more powerful anti-aging solution? If you're trying to stay looking youthful, which one of these should you do? One or the other, or both? As a facial plastic surgeon, I'm gonna break down exactly what each of these do and ultimately put this into perspective in terms of which one is the best solution for a long-term anti-aging. And for those of you who don't know me, I'm Dr. Amir Karam. I'm a board-certified facial plastic surgeon. I'm also the founder and creator of Karam MD Skin. And today we're gonna talk about a very, very hot topic, a topic that has been debated over decades. If you are trying to tackle skin aging, should you be doing Botox or should you be doing skincare? This is a topic that honestly I've had a lot of time thinking about, and I think I have a perspective that's gonna be somewhat unique. But understanding this starts with understanding exactly what each of these do in relation to how skin actually ages. So let's start off with learning about Botox and what Botox actually does in terms of anti-aging. Why do you use it in the first place? So here's how Botox works. Botox is a neuromodulator, and what that means is it directly interrupts the signal that your brain is sending from the nerve to the muscle of the face, causing the face to contract. Now, certain facial expressions around the eyes, like the forehead, the crow's feet, this area here, the glabella region, that type of repetitive movement, dynamic movement, leads eventually to a static line or a wrinkle. That transition from dynamic to static is what you're trying to prevent from happening using Botox. Remember, everyone expresses. Children express, 20-year-olds express, 30-year-olds express, but there's some point where that expression leads to a line there that is basically there even when you're not expressing. That is a static wrinkle. That is what you see in people's faces when they're completely at repose. They're not trying to move or do anything. They've got lines all over their face. So that is essentially the mechanism of prevention that where Botox comes in handy, and it does a beautiful job. In fact, it's been around for decades, and still to this day, there's no replacement. Now, remember, when I'm speaking about Botox, I'm speaking about this class of neuromodulators, which at this point, there's many of. There's Xeomin, there's Dysport, there's Daxi. So when we're talking about this, I'm just using the most common trade name, which is Botox, one of the original medicines for this particular use. But here's the point that I want you to totally register into your head right now. When you're 20s and 30s, you're expressing. I mean, since your infancy, you're expressing. But those lines don't matter, right? Because the minute you stop expressing, everything becomes completely smooth and flat again, right? So it's just a movement, it's an expression, but it's not a line or a wrinkle. The reason why those lines and wrinkles eventually become problematic and they get consistent with aging changes is not because you are moving them, it's because the skin on the surface above the muscle becomes thin because of collagen loss and the loss of elasticity due to the protein elastin. So as a result, every time you crease as we get older and these important proteins, collagen and elastin, are diminishing as a result of aging, sun damage, normal aging, etc., what ends up happening is slowly but surely, it doesn't recoil completely back to flat. It leaves a little bit of a depression each time and then eventually a larger depression. What Botox doesn't do is it doesn't address the underlying reason why your skin is aging in the first place. It doesn't affect collagen production, it doesn't affect hydration, it doesn't improve output of hyaluronic acid, which is an important part of drawing in water and creating a plumpness to the skin. It doesn't affect the ceramides or lipids, which are important for the overall skin barrier and the look of the skin, etc. So it's not doing anything to the aging process. It's just trying to decrease the impact of movement of the muscle on the surface skin. That's really important to put this piece of information here as we discuss the benefits and pros and cons of each of these. Given what it does and what it doesn't do, how often do you need Botox in order for yourself to prevent or improve some of these conditions? And again, keep in mind the most common areas are around the eyes, the glabella, the forehead, and around the crow's feet. How often do you do it is dependent on the biological effect of that neurotransmit blocker in this case Botox, and how long before your body clears it. So it's typically around 3 to 4 months. Botox is injected into the muscle, goes into the nerve terminal, blocks that transmission cascade from the acetylcholine, which is this neurotransmitter that can go across and create a signal into the muscle. It blocks that transmission pathway. And as a result, eventually your body responds by clearing that neurotransmitter and the receptor and creating new ones. Once that happens, then the new neurotransmitters that are free of Botox can behave like they normally do and cause that muscle to contract. That typically requires about 3 to 4 months for that to happen. So every 3 to 4 months, you do Botox to keep that muscle quiet so those lines and wrinkles don't form. Now, if you don't do it every 3 to 4 months, that's okay. However often you do it, during that period, your skin is taking a rest. Think of it that way. If you do it once a year, well, for 4 months, your skin's taking a rest. If you do it twice a year, it's getting 6 months. 3 to 4 times, it's rested the entire time. So the more it rests, the less likely it is to form a static wrinkle from a dynamic wrinkle or movement, right? But again, the underlying changes that are happening to the surface of the skin are happening no matter what. Skin is thinning, losing elasticity as time goes on. What's the typical annual cost for using Botox? It's typically around $1,500 to $3,000 a year, depending on the areas of the face that you treat, depending on the practitioner. These are ballpark averages per treatment, considering you're gonna do crow's feet, glabellar, and frontalis area, which is a very common combination to do. Now let's switch gears. Let's look at what skincare actually does. And this is something I became very fascinated by very early in my career, almost 20 years ago, because I thought about this as like, what comes first, the egg, or the chicken concept, right? I mean, is it the movement or is it the condition of the skin that leads us to even needing and thinking about Botox? The first and foremost thing you can do is keep your skin from thinning, keep your skin looking and behaving youthful. What does that look like? What does that mean? Here's a hypothesis. If you can actually keep your skin looking really young and functioning and anatomically be young, then as a result, you're not gonna need Botox or you're not gonna need it as much. That's the idea. And why would that be? Because 20-year-olds don't need Botox for the same reasons I just discussed, right? So here's how it plays out. Good skincare requires, number one, being on a really good sunblock. And I don't mean like the most expensive sunblock. I mean, good as in it has an SPF of about 30 to 50. It has UVA and UVB, so it's broad spectrum. It's generally a zinc or titanium oxide-based sun protection, so it's a barrier control, waterproof, sweat-proof, etc. And then you do it every single day and you reapply it every 3 to 4 hours. That's how you really take your first step towards skin anti-aging, because the sun is responsible for anywhere between 70 to 90% of the changes that are happening to skin. UVA leading to oxidative damage, leading to breakdown of the collagen and elastin in the skin, thinning and losing its thickness and elasticity, of which becomes the underlying reason why lines and wrinkles form in the first place. So, sun protection, key. Second is the use of active ingredients that are going to stimulate the collagen and elastin and improve things. So things like retinol, vitamin C, niacinamide, peptides, all of those things are stimulating and creating collagen and elastin to a level that starts to become consistent with what youthful skin production looks like. And that is why people who do this type of thing have beautiful looking skin, and they may or may not have even done Botox in their life. They just look like they have young looking skin, and they could be in their 50s and 60s and even 70s in some cases. Low sun exposure, good skin care, Botox need diminishes. This has been an observation that I've seen a lot of, but it also follows and tracks with what the control group would be, which is younger people, younger population, and what their skin looks like and how it resists fine lines and wrinkles from forming. It's because their skin's not thinning and it hasn't been damaged by UVA and UVB exposure over time. Key actives for improving thickness of the skin are the ones that I just mentioned, but you also want to plump the skin and bring a lot of hydration and moisture to the skin, and that's where the hyaluronic acid component and also the lipids and ceramide bring in moisture and water affinity, which HA or hyaluronic acid has a tremendous ability to attract water and plump up skin. So when you address plumping the skin and moisturizing the skin, as well as improving its barrier function and stimulating collagen, your skin's getting better over time. And you're preventing it from losing ground by protecting it against sun. If that all makes sense, ultimately what's gonna happen is your skin's gonna get younger and younger looking and decreasing in the need for Botox, because the transition from dynamic to static is unlikely to happen in healthy, youthful looking skin. Now, of course, in addition to that, you're also getting the pigmentation control with vitamin C and botanical lighteners and things like that that are decreasing discoloration, but that has nothing to do with wrinkles. Now, what does skincare not do that Botox does? Well, skincare doesn't do anything to prevent the muscles from contracting. It doesn't do anything to truly decrease the expression lines from potentially turning into static lines. But if you can keep that skin in good health and good shape, it's unlikely to happen anyway. Here's another thing that it doesn't do. It doesn't improve overnight. I mean, you use Botox and you've got some lines around your foreheads and things like that. It's working pretty quickly. Keep in mind, by the way, I love Botox. I actually have some in myself. I put in a very small amount of Botox. And when I say very small, I'm talking about, just for you, those of you who do it, I put 4 units here, 2 units here, and about 6 units here. It just takes the oomph out of it. It's been about a week ago that I did it, so I don't even know if it's fully kicked in yet. So keep in mind, I'm a fan of Botox. I'm just giving you the opportunity to understand relative to one another what they do. And as you all know, every day I do the trifecta, etc. Netta, same thing. She's been doing Botox since her mid to late 30s. She also does skincare and sun protection. So we're not saying one is better than the other, but it's important for you to understand what each of these do. So to put it in kind of perspective, Botox you're doing every 3 to 4 months. Skincare you're doing every day, and you're staying consistent with it. And you're doing it consistently because that's what it takes to get the stimulation going at the cellular level to get the collagen, the elastin, decrease the breakdown, all those kind of benefits that you're looking at. It requires daily use of it. So consistency versus every 3 to 4 months, but one is working fundamentally and the other one is working in response to, if that makes sense. And with skincare, probably like Botox, you're not getting off of it. I mean, when you're on a good anti-aging regimen, like when people start the trifecta, the expectation is that they're doing it every day and they're doing it forever. This isn't like a point where, you do it for a while and then you stop. It's not like surgery where you get this big change and then you can kind of lay back for a while. This requires commitment over time. The annual average cost for skincare is so varied because products cost all sorts of things. I mean, you could get a regimen that includes all the things that I just talked about for anywhere from $500 a month all the way up to $4,000 or $5,000 a month. The trifecta monthly is around $264, which is roughly around $3,000 annually. Premium products generally cost more. Advanced innovative formulas cost more. These are things that ultimately you have to look at based on your own budget, etc. But at the end of the day, making sure you get those components is absolutely key. So Botox versus skincare, which one's better? Obviously they're totally different, right? So think of Botox as prevention of the process that I just described. Think of skincare as foundational, that is basically correcting and preventing. That's the way to think about it. The ideal approach is probably to incorporate both of those, but if you had to pick one, and I mean this honestly, if you had to pick one, 100% I would favor the use of sun protection and skincare over Botox. In the long run, you'll win with that approach. You just gotta be patient because your skin's gonna get better as time goes on. Whereas Botox, immediately you'll see fine lines and wrinkles improving around your eyes and your foreheads, etc. And if you were thinking, okay, well, I'm on Botox, so that's as good as skincare as I need, that's wrong. Botox is not skincare in the classic sense of anti-aging and improving your skin. It is a beautiful add-on, but it's not a replacement for good skincare and sun protection. So let's put it into context about where Botox fits in the hierarchy. This is how it would play out. You go sunscreen first, you go retinol and vitamin C number 2, you go peptides and hyaluronic acid and ceramides, lipids, niacinamide, etc. as number 3, then you go Botox. That's kind of how you play this out in a hierarchy or level of importance when it comes to anti-aging. All right, so that's the final verdict. That's the way I look at this, and I'm very, very curious after hearing about it this way and kind of understanding where each of these plays a role in the continuum of skin aging, how you feel about skincare versus Botox, and did it change the way you look at the subject matter? Ultimately, at the end of the day, you have to make the decision that feels best for you. So make sure you drop a comment, let me know what you think, share this with some friends and families, and if you enjoyed it, hit like, and do not forget to subscribe. I'm gonna put a newsletter associated with this that'll help you kind of review this and see it in context. It's a Karam MD journal. Make sure you subscribe to that as well. If you like this type of content, it'll come to your email once a week. All right, folks, thank you so much. Until the next Skin School, Dr. Amir Karam.